Hi, my name is Carly Klein with Dr. Shelly Friedman's office, and today we're talking to a 30-year-old female patient who had concerns of a high forehead, who came in to see us a week ago, last week, had her first surgery with us. We're just going to talk to her a little bit about her experience. So thank you for coming.
Thank you.
Tell me about what your first concerns were about your forehead.
Okay. As a woman, we always strive to want to feel feminine, and my forehead is naturally high. It starts back a little further. I'm not balding or losing hair, but my forehead just naturally started back high. So I always felt a little masculine, more masculine than I wanted to feel. So I tried everything to hide it, cover it, and nothing really would work. So this is why I came to you guys.
So when did you first start looking into hair transplants?
Probably a year ago, I Googled high foreheads just to see if there was a medical cause for it, and when I saw that you could do transplants specifically for that, I almost fell out of my chair. I was so excited.
Good. So tell me about your experience with Dr. Friedman and his staff.
Okay. My first meeting with him, he looked at my hair and my scalp, just the density of my hair, to see if I was a candidate for it, and I was. I'm happy about that. And he had lots of information he shared with me. He encouraged me to ask lots of questions. He was gentle, and then sent me home to think about it. And I thought about it, and when I came back, it was really quick. It was near painless, and I'm excited to see what the results are going to look like.
Good. I'm excited for you. So, how many grafts did they do?
I believe they did somewhere around 1,700. I'm sorry, somewhere around there.
And so after the day of surgery, did you feel like he had explained everything that happened during the day prior? Did you feel like there was any surprises during surgery or anything like that?
No, both him, yourself, and the rest of the staff were very informative. The website's informative, so I studied up. There was nothing that I didn't know about. In fact, I think the pain-free experience was understated. I was expecting more pain than it was.
Good. Well, excellent. Well, let's take a look a little bit closer of your hairline so we can see. So this is going to be 7 days exactly to the date post-op of what her hairline looks like. We also do, and we'll talk about an ointment. We do an ointment 4 days, 4 times a day right after surgery, and this eliminates you from getting any scabbing. And then we do 10 days after surgery. For the next 10 days, we do laser treatment. And this really helps promote healing within the skin to the new grafts and also to the suture line. So let's take a closer look. So this is 7 days post-op of her surgery. And how many laser treatments have you done so far?
2, not including the one during surgery.
Okay, so she's done 2 laser treatments, and again, we've just lowered that hairline, and as you can see, she's got a lot of tiny little grafts that will fall out within 3 to 4 weeks, and she'll look just like how she used to. Now we're going to go back and we're going to look at the sutures. So as you can see, the sutures are completely hidden. And then this is the sutures. So you can see a tiny sutures that will be taken out 2 weeks after surgery. And then what happens is you'll have a little fine line scar. If you turn it your back side of your hand, it's about the size of a crease in your hand. So 6 months to 9 months is when all those grafts will be growing, and she'll start to see a difference.